The power of social media is huge, but it also gives a platform for misinformation to spread. And with something as important as a vaccine for COVID-19, it's also important for the general public to have the correct information. On Thursday, in a 17-4 vote, the FDA concluded the Pfizer COVID-19 vaccine is safe and effective for mass distribution, now just waiting on finalization.
I absolutely approve. I would be one of the first ones to take it if they would offer it.
But some people are not so eager and still have a lot of questions. So we sat down virtually with CHI Health infectious disease experts to explore some common questions. So, how can a vaccine that was developed so quickly be trusted? Well, the short answer is the urgency of the global pandemic and funding.
This technology has been around. It's just funding and the push hasn't been as much. But with this, pandemic, lots of funding was given and the technology was already existing. So that's how they took the technology and developed this vaccine.
The Pfizer vaccine is made of messenger RNA. So will it affect or alter our DNA?
One thing to know is it's called messenger RNA, so mRNA. It stimulates our body cells to produce the antibodies, but it does not enter into the nucleus, which is where our DNA is kept. So it doesn't get in there. It stays outside.
And what about reports of allergic reactions?
Cases in England where people had some severe reactions, so haven't heard a lot about that yet, but anxious to hear more.
We don't know the medical records of these two patients who had that allergic reaction in UK, exactly what happened. But from sounds of it, they had history of severe allergy because they were carrying around EpiPen.
The vaccine will also come with a warning for people who have severe allergic reactions, and individuals will be monitored for 30 minutes after their vaccinations. Finally, what percentage of the population needs to get vaccinated for significant change of infection rates?
Something is better than nothing, but ideally, in order to help each other, in order to curb the infection, we need to get more of our population to get the vaccine. A good number might be more than 70%.
That's 70% of the population that has to be convinced that the vaccine is for them. That's why asking questions and debunking myths is so important. Reporting in Omaha, Rudolph Sinaida, 3 News Now.